Staff gather for their improvement huddle at Ward 24 at Wexham Park. Every day the team comes together to discuss how to make things better for themselves and their patients. The Frimley Excellence Improvement System is gradually being introduced to more and more clinical areas across Frimley Health. The new way of working empowers teams to take more ownership of their own performance. Staff receive coaching, learn new skills, and also work on local improvement projects.
The Frimley Excellence Improvement System is all about helping frontline teams make daily improvement. They start by understanding what matters the most to them, their patients and their families, and then from this how they can collect easy data on a daily basis. From this idea, they then identify which one thing they want to improve. Rather than trying to improve everything all at once, taking this focused approach allows them to really dig into one idea and work out what they want to do better.
So the Frimley FX programme has helped us look at staff wellbeing, and from looking at that we have put into place some things on the ward. So we have made a wellbeing room that is for staff to use whenever they feel the need. It has a fish tank, it has yoga facilities, it has bean bags, there's a CD on the wall for calming music, and people are welcome to use it whenever they feel the need. We've also had the wellbeing team from the hospital come up to the ward and offer one-to-one sessions and group sessions whenever people feel the need. They also brought some little freebies up to the ward, which is obviously very much appreciated. And through having our daily huddle, it helps us to focus where there's been issues so that we can deal with them as they arise.
Part of Frimley Excellence is developing the capability of our organisation to problem solve efficiently and effectively. Through a range of learning experiences, we're equipping individuals and teams with the skills and knowledge to address the issues that are important to them. There are many learners who've already completed a Frimley Excellence course, gaining either white belt or yellow belt qualifications in Lean Six Sigma. These courses focus on the skills needed to identify and remove waste, how to build and deliver an improvement project using the collaborative A3 thinking, and how to ensure the activity delivers real benefits for our patients, our staff, and the whole organisation.
So through the White Belt training programme, I've learnt that we're trying to obviously continually improve what we do using the sort of lean principles and trying to identify waste so that we can make our teams and our workplaces as efficient as possible. So from doing the White Belt programme, we've set up a jam board amongst our teams so that as we are each going through our sort of everyday working lives, we can put forward ideas and then come back together as a team to sort of reevaluate those and decide what we want to take forward as our identified wastes.
The best thing about my yellow belt training was that we trained together as a team. We got to use the same terminology and learn the approach together so we could discuss things as a team and move things forward. And it helped me to realise the importance of understanding the problem statement at the outset, so engaging stakeholders to clearly define the problem so that we all knew what we were working towards. It's actually given me the confidence to be more flexible and adaptable, so carrying out small tests of change, avoiding waste and duplication so that we can move things on more quickly. The main learning and the main way in which I've used the quality improvement methodology is within the Falls project across the Trust. So our ambition to reduce falls by 40% was key, and it helped us identify the problem at the outset. Importantly for me, stratifying the data became quite clear and was a new thing for me to learn. So breaking down our data so that we could understand the smaller problems and the small approaches that we needed to make to start to make a difference to patient safety.
So I've been working as a clinical quality improvement lead to help support junior doctors from F1 up to the end of their registrar training level with any quality improvement project ideas that they've got. Either they come with their own ideas of things that they want to improve within the department that they're working in, or they feed into bigger trust projects that we have with the Frimley Excellence Team as support as well. We run once every quarter a meeting sort of with all the consultants that they can present their projects to in the grand round, and I feed into their teaching programs to give them some quality improvement teaching and support, and we have a weekly drop-in clinic where they can book an appointment and go through their ideas or tell us what they're struggling with, and then we can try and help them through it.
So the projects workstream is one of the work streams that we have in this Frimley Excellence programme to support us in the delivery of our strategic ambitions. This means we have a number of large-scale improvement projects which support our work across the organisation in delivering improvements to our services. We also support a number of smaller scale improvement projects which are commonly known as QIPs, or Quality Improvement Projects.
Staff on Bourne Ward at Farnham Community Hospital gather for their falls huddle. Following A3 problem solving, they discuss the problem, review their data and determine the root cause of inpatient falls that have occurred.
The FX team's helped us mostly with the support to reduce the number of falls in the hospital with that project. We're 84 individual rooms. Our patients are frail, elderly, or sometimes with cognitive impairments. They're a huge falls risk. It's a very challenging environment, and the FX team's helped us very successfully reduce our number of falls.
So one of our large-scale improvement projects is to support the care of our stroke patients. This large-scale project has resulted in an improvement from less than 40% to consistently above 60% of our suspected stroke patients being admitted to the hyperacute stroke unit. We've achieved this by supporting the use of ring-fence beds, multidisciplinary step-down decisions and improved stroke screening in our emergency departments. A project to support the management and recognition of those patients who deteriorate whilst in our care has led from 24 patients in 2019 to just 4 in the last 9 months. In terms of the things that we have done to enable this, have been a process for escalation of abnormal bloods, changes to the way we work to support staffing of our hospitals at night, and improved identification of new confusion.
I'm Razia Hussain. I'm the Trust GIRFT Project Manager. GIRFT is a National Quality Improvement Programme. It stands for Getting It Right First Time. It started in 2012 following an orthopaedic pilot led by Professor Tim Briggs. Professor Tim Briggs was able to demonstrate that there's 30 to 50 million pound saving to the NHS following his pilot project. Due to this success, it's been rolled out to now over 40 medical and surgical specialties. I support the specialties with their improvement programs and work quite closely with the clinical teams as well. One of the biggest projects I'm working on at the moment is around day surgery. I work quite closely with the cross-site clinical lead, Deepa, and we support specialties with ensuring that they work towards the GIRFT best practice pathways. Some examples that I can share of innovative changes that have been made include our fantastic orthopaedic team who've been able to ensure patients go home the same day or the following day following hip joint replacement, and also our breast team who have reviewed their mastectomy pathway and worked with our community partners to ensure patients go home the same day.
While it's been a really challenging year, it's also been a really exciting year. We've seen some huge transformation already underway. We've got the new build with Heatherwood, we've got our epic EPR build coming online next year as well, but of course the Frimley Excellence programme. We've been empowering people across the organisation, making small scale changes and large scale changes as well to really make great improvements to provide outstanding care to our patients.
Well, it's been great working with Frimley Excellence this year to help deliver our future FHFT, which is our organisational strategy. They provided some real clarity around some of the key programmes of work, helping to deliver that future. And the important thing for me is that they've allowed people from all levels and all parts of the organisation to make their contribution to the overall strategy.